For those of you who don't know, Lieutenant Commander Branch is the Director of the Office of Minority Health in Kansas City at HHS. So she's been an amazing partner for us here at the university, and we really appreciate working with her. So I'll turn it over to you.
Thank you. Because I know that, thank you, because I know that everyone can't wait to get on the road and get out of here. I'm going to keep this short and sweet. Basically, Nancy asked me just to give you all an idea as to where do we go from now, because I assume that everyone sitting in this room is just like me. You go to these events and you get extremely excited after you hear all of these like-minded people talking about these activities and these ideas, and you want to run back out there and save the world. But then there are always those barriers, things like money, and those partnerships and those collaborations, and I don't know who's doing those things that I need to partner with in the community. So for that reason, I want to do what I can to make sure that I'm not quelling any of that excitement or that enthusiasm that this conference has created. And for that reason, I want to provide you with some tools that will allow you to go forward and do the things that you want to do. Nancy is one. I'm trying to think. Eduardo, are you still in the room? Okay. Myrna, stand up. And I know Joe was here earlier and he's gone. Nancy and Myrna are in the room, are two of the members of what's called the Regional Health Equity Council. The Regional Health Equity Councils were created as part of the National Stakeholder Strategy, which was released last year. And what this is a framework that provides information on how to achieve health equity. It's a scalable framework that can be used by small faith and community-based organizations, but can also be utilized by national and federal and state agencies to reach health equity. It has 5 overarching goals that you can address with 12 strategies that you can really drill down on that allows you to work around any of your programs, any of your health disparities that you're looking to address. I think the most important part of this National Stakeholder Strategy is the fact that, as many of our presenters this morning this morning and this afternoon spoke about, are the social determinants of health and the fact that we have to work across sectors. So I can't even begin to say how many people talked about transportation being a barrier for the things that you're trying to do. Individuals in terms of literacy and health literacy, individuals in terms of low socioeconomic status. All of those are social determinants of health, and all of those are things that the Regional Health Equity Council, when they were put together, were looked at in terms of making sure there was representation on those councils from all of those sectors, as well as because for Region VII, for Health and Human Services, it encompasses 4 states, so Missouri, Kansas, Iowa, and Nebraska. We also made sure that those councils had representation from each of those 4 states. And for Missouri, you have 2 of the members in the room. Because of the fact that for those 4 states, we're looking at 13 million people that they are working to address health with, 37 people, which is what the current council is made up of, can't do it. So this is where you all come into play. I want you to take that enthusiasm, I want you to take that motivation, and I want you to start reaching out to, you can contact myself, Nancy or Myrna, about the organizations that you're working with, the types of partnerships that you're looking for. We also need individuals who are willing to serve on the committees and the work groups. And those committees and work groups are going to be built around a lot of the work that you're doing. So obesity being one of them, infant mortality being another. So those are some of those things that they're going to be looking to address. So, my short and sweet message to you is do something, and look to do something preferably with a regional group that's put together to do the same things that you're looking to do.
Is there a website that folks can go to?
Thank you, because I jotted that down and forgot to mention that. silly things like that. If you want more information about the stakeholder strategy or just about the regional health equity councils in general, you can go to the Office of Minority Health website. It's www.minorityhealth.hhs.gov. So minorityhealth.hhs.gov.
Thanks, Tracy. That was great. And one last little plug, the Missouri Health Equity Collaborative, we do have a website. It's mohec.org, mohec.org. And monthly now we're having blogs. If you've never written a blog, we have some instructions on how to do it. But this is a great audience of blog writers, right? So if you want to write a blog about health equity and health disparities, we want to hear from you, right? Okay. Oh, yeah. So please join mohec.org. If you want to be part of the listserv and you're not, let us know.
The mohec.org, too, is also kind of think of it as an online community, so you were talking about, we don't have that one place where we can see what else is going on and things like that. We do have a calendar of events, so if you get that information to us, we can get it out to everybody. And we do have listings of researchers and research that's going on, so if you share that with us, we can share that around, and so it's a good place to look for other collaborators and make some contact.
It's kind of a virtual community of people interested in this issue in Missouri and beyond. So I want to thank you all for your attendance. Please fill out your evaluations and have a great weekend.